Welcome to this presentation on sexually transmitted bacterial infections and what you should know. For this presentation, I'm going to focus on the more common bacterial infections that are transmitted by sexual activity. There will be a second presentation on viruses that can be transmitted sexually, so make sure you view that one also. Most people worry about unintended pregnancy as a consequence of sexual activity. Abstinence, or not having sexual relations at all, is the only 100% effective birth control. Condoms alone have a failure rate of 14 to 15%, meaning 14 to 15 people out of 100 will become pregnant. Adding spermicide increases the effectiveness to 95 to 99%. Condoms are recommended for use even if other birth control is being used to decrease the chance of transmitting infections. Some people use the term sexually transmitted diseases while others use infections. Some are infections that can be cured, and some become diseases which are chronic or a permanent part of you. So both terms are correct, but sexually transmitted infections is the terminology used now, and that's how I'll refer to them for this presentation. I'll cover chlamydia, gonorrhea, syphilis, and trichomonas. Most infections are caused by viruses or bacteria. Only one, trichomonas, is caused by a protozoa, and we'll talk about that in a little bit. Some are transmitted with just skin-to-skin contact, so it doesn't have to be genital contact. Some can also be spread by the mouth touching other body parts or transmitted to an infant during the birthing process. Most are preventable with certain precautions like faithful condom use, only having one sexual partner in a long-term relationship, and not having multiple partners. Infections can be treated with antibiotics, but viruses can cause genetic changes that make it difficult to completely get rid of or control the virus. Some infections may not produce physical symptoms immediately, but can cause inflammation and scar tissue formation internally that can result in infertility. If untreated, infections can progress, and some can affect other body parts. Some can even result in cancer or death. Most people don't realize that testing immediately after a sexual encounter may not detect if an infection is present. Some infections may show up in tests within 2 days, but others may not show up on tests for about 6 months. So if you suspect that you may have been exposed, it is critical that you complete any follow-up testing that is recommended. There are about 50 million cases of chlamydia worldwide, and 4 million cases are reported annually in the United States. This computes to about 1 out of every 270 people being infected. It's the most frequently reported infection in the United States. Rates of infection have increased 5.9% between the years 2013 and 2015. Highest rates are reported in women 15 to 24 years of age, and it is highly transmissible. Risk factors include new or multiple sexual partners, history of having a sexually transmitted infection in the past, being under the age of 25 or having sex at a young age, oral contraceptive use, and lack of condom use. Chlamydia is a bacterial infection transmitted by sexual contact, or it can be transmitted during birth to an infant. 80% of those infected do not have symptoms, and if symptoms occur, they may mimic those of a urinary tract infection, which include pain, frequency, and urgency with urination in men and women. There may also be a yellowish mucus-like discharge or pelvic pain in some cases. Chlamydia can also infect the eyes, throat, vagina, penis, or rectum. Men and women can remain without symptoms for a long time and spread the infection without even knowing they have it. So how soon can you be tested? There is an incubation period, or a period of time the infection is present but not in sufficient amounts to turn a test positive. Often tests done in the first week are negative. It generally takes 1 to 3 weeks at the earliest to detect chlamydia, but can take up to 6 weeks. If you contract the infection and had symptoms, anyone you had sexual contact with in the past 30 days should be tested. And if you didn't have any symptoms, anyone who you had sexual contact with in the past 60 days needs to be tested, whether they have any symptoms or not, and even if you use protection like condoms. Many cases of chlamydia are picked up with just routine screening on Pap tests, and the person does not have symptoms. It can be treated with antibiotics, but it's essential that they are taken as directed and to avoid any sexual activity while being treated and for at least 7 days after treatment is complete. If not treated, it can lead to pelvic inflammatory disease, which can cause lower abdominal pain, fever or chills, increased vaginal discharge, nausea and vomiting, low back pain, and abnormal vaginal spotting or bleeding. If left untreated, this can result in internal scar tissue formation, chronic pain, and possibly infertility. Gonorrhea is another bacterial infection. While it isn't as common as chlamydia, about 1 in 1,000 people are infected with it. It's easier to spread from a man to a woman, but can be transmitted from women to men also. It can be passed on to an infant during birth, and it can result in eye infections and blindness. Risk factors for contracting this infection are the same as with chlamydia. It generally takes 2 to 10 days for symptoms to appear depending on where the infection occurs. Screening for gonorrhea is not recommended unless a person tests positive for another sexually transmitted infection or it is suspected based on the symptoms. This infection can take 2 to 30 days to show positive on testing, but sexual partners in the past 60 days need to be tested because it also can be asymptomatic for a while, making it very difficult to pinpoint exactly when the infection occurred. It can be treated with antibiotics. It can infect the urinary system, causing pain with urination and yellow, white, or mucousy penile discharge in men. Women tend to have greenish, irritating vaginal discharge as well as fever, pelvic pain, and menstrual irregularities. Syphilis is the next bacterial infection we will talk about. It's more common in men having sex with men, but women can get it also. It can be treated with antibiotics if caught early, and it also can be transmitted to an infant during birth. Syphilis has 3 stages: a primary stage, or the initial stage, a secondary stage, and a tertiary or final stage. Primary syphilis, or the first stage, is generally characterized by a painless genital ulcer and swollen lymph glands, usually in the groin region. The next phase is the secondary syphilis, which is characterized by a rash on the palms of the hand or the soles of the feet, patches on the mucous membranes, widespread swollen glands, flu-like symptoms, and possibly patchy hair loss. Tertiary syphilis is the later stage, where tumors can develop on organs, and it affects the heart and neurological system. In between each of these stages, there is a latent phase, which is a period of time where there are no symptoms, and these phases can last a varying amount of time. Syphilis can be treated if it's detected during the primary, latent, or secondary phases, but it's important that testing after treatment is done at 6 and 12 months to make sure that the treatment was effective. Trichomonas is the last infection in this presentation, but it's not a bacterial or a viral infection. It is caused by a protozoa, which is a microscopic organism. Trichomonas rates are not known because it isn't a reportable sexually transmitted infection. It causes a large amount of yellow-green or watery gray vaginal discharge, a foul odor, pain with urination, pain with sexual intercourse, spotting or bleeding after sex, abdominal pain, or vaginal itching, but it also can be asymptomatic, but that is less common. It is treatable, and sexual contact is not recommended during treatment. Sexual partners need to be treated even if not showing symptoms of infection. It is recommended that someone who develops this infection be retested in 3 months to ensure it is completely cured. This is the infection that years ago there was debate about non-sexual transmission from toilet seats or furniture. Scientists state it is possible, but is extremely rare. For more information, visit the CDC website for sexually transmitted infections. This is a reliable source with research-proven recommendations. This is my reference list for this program. Thank you for your time, and again, make sure you watch the Sexually Transmitted Virus program. Thank you.